Coronary artery disease is a common heart complication that can affect anyone. Hi, I'm Dr. Camilo Te, and I deal with patients who are complaining of chest pain. This is ManilaMed's Ask Our Doctors. Let me guide you through the ins and outs of CAD and what you can do to manage its symptoms. Let's take a look at your questions from Twitter. At Manila Girl asks, what is coronary artery disease and what causes it? So coronary artery disease, or CAD, is a pretty common heart condition. It is also known as coronary heart disease. So CAD happens when there is a blockage of your coronary arteries caused by plaque buildup. This plaque buildup limits the oxygen and blood that reaches your heart. So there are basically two main types of CAD. The first is stable ischemic heart disease, which we term a chronic coronary syndrome, and it's something that usually happens day to day. On the other hand, there is an acute coronary syndrome, which requires more urgent or even emergency care, as it is caused by a sudden blockage and blood clot that blocks blood flow to your heart, causing a heart attack. So at @AthleteThings789 asks, what are the typical symptoms of CAD and how is it different for men and women? So a common symptom of CAD is angina or chest pain. And angina can be caused by strong emotions or physical activity. You may experience tightness or pressure on your chest. Some people, especially women, experience a brief and sharp pain in their chest. Shortness of breath, fatigue, and a heart attack are other common symptoms of coronary artery disease. Moving on over to Facebook, here are your questions. At 𝗨𝗶𝗱𝗶𝗃𝗀𝗃𝗀𝗃 asks, how can I prevent or reduce the risk of developing CAD? Coronary heart disease can involve risks you can't control, so it's not the easiest thing to prevent. But the good news is, there are a lot of things you can do to manage the condition and prevent it from getting worse. So first things first, you can try to quit smoking and avoid alcohol intake. It's also equally important to stick to your medications, get enough exercise, maintain a healthy weight, get enough sleep, and eat a healthy diet. This means limiting your intake of food with trans and saturated fats. Refined carbohydrates like pasta and white rice, as well as sodium and sugar, should also be reduced. So, it's Trisha21 asks, can my CAD get worse? What are the other complications I might experience? So apart from angina and a heart attack, you may also experience arrhythmias. So this happens when there is not enough blood in the heart, causing irregular heart rhythms. And then there's heart failure, which is caused by narrowed arteries that make it difficult for the heart to pump blood as well as it should. At PeaceandLove444 asks, can CAD be reversed or cured with proper treatment and lifestyle changes? So while some heart diseases have no cure, it cannot be reversed, coronary heart disease can be managed. So this is done with a healthy diet and lifestyle as mentioned earlier. Visit ManilaMed today and feel better with the best. Follow us for more health and wellness information.